I'm Adam Olszewski. I'm an associate professor of medicine at Brown University and a clinical hematologist at Rhode Island Hospital. And I will talk to you about our experience with development and validation of the Burkitt Lymphoma International Prognostic Index. Burkitt lymphoma is perhaps the highest grade B-cell lymphoma, mature B-cell lymphoma that we see in clinical practice. Historically, it was difficult to stratify patients in clinical trials and in clinical practice with regards to their risk. Most patients end up in the very broad category of high-risk Burkitt lymphoma, with a very small group of those assigned to low-risk attenuated treatments if they have localized disease. We have developed a Burkitt lymphoma-specific international prognostic index, recognizing that the standard IPI is not very useful in Burkitt lymphoma because most patients present with advanced disease and elevated LDH, and they also present at a younger age than typical patients with DLBCL. For this purpose, we used the experience of 633 patients who were treated in the United States over the past decade. And we developed a prognostic index that includes 4 risk factors: age equal to or over 40 years, LDH over the 3 times upper normal limit, poor performance status equal to 2, 3, or 4, and involvement of the CNS, which was observed in 19% of patients in this cohort. This index stratifies patients into a low-risk group with no risk factors, intermediate group with 1 risk factor, and high-risk group with 2 or more risk factors. And the low-risk group has a progression-free and overall survival exceeding 90%, excellent outcomes, and constitutes approximately 18% of the all population that we saw in the cohort. And the high-risk population is about half of patients with Burkitt lymphoma, and they have 3-year progression-free survival of only between 50 to 63% at 3 years. I'm giving a range of results because we've externally validated this index in a separate cohort of patients treated internationally in Canada, Europe, Scandinavia, the UK, and Australia. This was a cohort of 457 patients treated primarily with CODOX-M IVAC chemotherapy. And in this cohort, we validated adequate calibration of this index. The BL-IPI stratified patients roughly the same sizes of low, intermediate, and risk groups, although the outcomes, interestingly, this international cohort was slightly higher in all groups. But again, the low-risk group exceeded survival of 90%, and the high-risk group had a long-term progression-free survival of only 63%. So this index is derived from retrospective data, and it cannot be easily used for application to current treatments. These patients were treated using standard therapies. However, it can help stratify patients in future clinical trials, as well as describe the risk distribution in smaller phase 2 studies that have been conducted and will be conducted in the future. And it also can help design future trials. This low-risk group is a prime target for de-escalation of highly intense therapy that we use currently. And this group is larger than the previously narrowly defined low-risk group. On the other hand, the high-risk group, which is still about half of patients with Burkitt lymphoma, is a good target for new treatment approaches, since their outcomes are only with about 50 to 60% of long-term survival. We hope that this new BL-IPI, or Burkitt Lymphoma International Prognostic Index, can be used by clinicians and researchers for stratification of the risk of patients in the future.